Welcome to VNA Health Highlights, a program of the Visiting Nurse Association of Cape Cod. I'm Jeanne Sarnosky, and on today's program we're going to learn a little bit more about vestibular rehab, and we're lucky enough today to have Donna Hardy, who is a physical therapist with the VNA, as our guest. So thanks, Donna, for being here. I appreciate your time.
Well, thank you.
This will be fun. So I always like the viewers to get to know you a little bit.
Yeah.
So how long have you been with the VNA?
I've been with the VNA probably close to 16, 17 years, on and off a little bit. I've been a therapist for over 31, and for the last 20 years I've either been with the VNA or Cape Cod Hospital.
Oh, okay. And physical therapy was something that caught your eye early on, or?
No, I went to college as undecided major, and I went to the University of Connecticut, and luckily they had a PT program. I knew I always wanted to work with people, and I liked the medical field, so I just went for it, and I've loved it ever since.
It is a great field.
Yeah,
Anytime I've been in a situation where I've needed PT or had PT, it's just amazing the work that you do and how much success comes out of it.
That's the part I like about it. You
Yeah.
really see a lot of success and a lot of, gives you a lot of satisfaction.
Yes. I think our patient satisfaction surveys that we have at the VNA, the PTs always score the highest. And I think it must be that because you have that before and after success of, I feel crummy, I go through all these exercises and PT and I come out feeling really fabulous. So
Definitely.
Very good. So we're going to talk vestibular rehab today. So I'm just going to have you take it from there.
Okay.
What is vestibular rehab?
Well, vestibular rehab is very complicated, and I don't profess to know everything about it. I've taken a lot of courses recently about it because I saw a lot of people working in the hospital who had it, and then I realized we were sending these people home, and they still weren't completely better. So I could definitely see a huge need for it in home care as well. Vestibular rehab is treatment by a doctor or therapist, either occupational therapy or physical therapy, for someone who has vestibular system disorders. And that could cause balance problems, it could cause visual disturbances, feelings of unsteadiness, nausea, and just an overall sense of just not being quite right.
Oh, yeah. So is it familiar? Is it a word that's familiar to most people, would you say?
No. Most people, vestibular, think of the inner ear, and some people think that there's just one inner ear, but there's actually two inner ears, and that's what the vestibular system is made up of. Our inner ears are located on each side, just beneath our skull, next to our outer ear. I have a diagram.
Sure.
Which way should I hold this, like right here? This is a picture of the outer ear, the middle ear, and then the colored portion is the inner ear. The blue portion is the cochlea, which is responsible for hearing, and then the green portion is the labyrinth. I don't know if people might have heard that term. I don't know. And that's made up of semicircular canals and a couple structures right underneath it. And this whole green area is filled with fluid, and that's what helps us balance. When we move our head, the fluid in our head moves, and that automatically triggers nerve impulses to go to the spinal cord, the brain, and it's a reflex. It's almost instantaneous that the brain will send our muscle signals to help us balance. So for instance, if we were standing on a boat and we were nice and even, and then all of a sudden the boat tipped to the left, almost the fluid in our inner ears would slosh a little bit that way and signal our brain, and the brain would it's a reflex reaction, almost instantaneously send messages to our muscles to help us right ourselves back to the right.
Oh,
So
yeah.
So
is the vestibular system all within the ear?
No, it's the inner ear and how the inner ear works with the nervous system.
So it's the whole package.
The whole package.
Okay.
Yes.
So is it the same? This is going off on one because is it? So I've had people say when they're on cruises and the boat gets moving, and to not have that nauseous, unbalanced feeling, to go into the pool. If it's decent weather and you can be in the pool, because the water in the pool
Water in the pool
goes with the rest of it, and they don't have that funny feeling.
I never heard of that.
Oh,
but
okay.
Sounds good to me.
We'll have to go look that one up because I thought, really, that's amazing. But it makes sense
Yeah.
based on what you've been saying about the fluid in the ear. Okay, so we talked a little bit about how that works. Is this system the only way the body balances itself?
No. This is one of 3 systems of how our body balances itself. The vestibular system is one. The second one is called the somatosensory system. Basically, it's how we feel, our sensation, the sensation in our feet, the sensation in our joints. So for instance, if I am holding my hand this way, I'm not looking at my hand and I can't see that my hand is pointing up, but I know my hand is pointing up by the sensation I feel.
Okay.
So if we're standing and we have a lot of weight on our heels and we're kind of tipping backwards, the sensation in our feet will tell us that we're tipping backwards, and we, again, through reflexes, right ourselves forward.
Okay. All right.
And then the third system is our visual system. We rely on our eyes a lot for balance, especially people who don't have good sensation, people like with diabetes or with circulatory problems.
Oh, neuropathy or something.
Yes.
If they had
Exactly.
Okay.
Exactly. So it's really evident, especially as you get older. Most of my patients rely on their vision so much, even patients who are considered legally blind, because they could still see shadows and still be able to write themselves.
Oh, yeah.
I wanted to show one example, and don't try this at home. You're going to stand up, and I'm putting my feet together, and I'm focusing straight ahead, and I could balance pretty well this way. Now, when I close my eyes, you can start watching me, and I'm not doing this on purpose. I'm wavering back and forth a little bit.
Oh, yeah.
Okay?
Yeah.
I went to a course once, and the instructor had us all stand on one leg, and I was doing fine. And then all of a sudden, he told us to close our eyes, and I fell over because we didn't have those visual cues to tell us where we were.
Right.
And that's one way to strengthen the other systems, is to close your eyes and practice. And it strengthens the other systems, and that's part of vestibular rehab.
I have a yoga class that I attend, and we do some of those balance exercises, but she keeps the lights really low, except for when we do those particular exercises.
Yes.
And then she pulls up the lights a little because with that comment that
Definitely.
you need the lights to help maintain your balance, because these are tricky enough as they are.
Definitely, and that's one of the things I tell my patients is everything really should be well lit. Dark, a lot of times falls happen at night when people get up and go to the bathroom. It's because they can't see as well.
Orientation and balance.
Exactly.
Oh, yeah.
Exactly.
Okay, so the 3 balance, that would be the vestibular, the sensory
system, and
sight.
Visual.
Okay. Now, are vestibular problems a common thing?
Very common.
Very
common. One of the statistics I recently read was people over the age of 70, the first thing, one of their major complaint they have is dizziness. And people over the age of 65, 1/3 of that population will fall every year. So
wow.
It's huge.
So a lot of the viewers will find this all very familiar.
I hope so.
Yeah. Now, is vertigo something different?
Vertigo and dizziness are really the same thing, but dizziness can describe other symptoms and situations as well. Dizziness is kind of a catch-all term.
Okay.
It could describe some people have used it to describe when they stand up quickly, they might feel lightheaded, they might feel heavy-headed, feelings of imbalance or unsteadiness when they're walking. A lot of people kind of clump that all into dizziness.
Right.
Vertigo is a specific kind of dizziness. It's the feeling you get that you're spinning in the room or that the room is spinning around you. And frequently, the patient who does have vertigo will use this motion and just use their finger to tell you that that's how they're feeling.
Oh, yeah. Wow.
Yeah.
So that should be familiar to some people too. Yeah, that's
Yes.
probably a more familiar term.
Yes.
Vertigo.
Vertigo. Yes.
Is there a most common vestibular problem?
Well, the one that I've seen the most common, and it is pretty common, is called positional vertigo. And you may have heard it called benign paroxysmal positional vertigo.
Okay.
I just like to say positional vertigo, or BPPV.
Okay. And what causes that?
Go back to that. Back to our little drawing here. Again, this is the inner ear. The green part is our labyrinth, which helps us balance. Inside one of these sac-like structures down here are crystals. They're called otoconia, but we'll call them crystals. They sit on top of little cells, hair cells, that sway back and forth when the fluid is moving. And they are actually what sense the movement and helps to sense the movement to send it down the nerve pathways to the brain. Sometimes those crystals, just like our bones in our body, they get a little bit more brittle and they break off. The experts say that 40% of the cases they don't know why they break off, but in the cases that they do, sometimes it's hitting your head or getting a whiplash injury, and that happens more in younger people.
Oh yeah,
because younger people can get this, even though as you get older, more into your 50s, 60s is when you tend to first start feeling it. It could also be due to lack of circulation to the area, infection.
Okay. So is aging part of it?
Yes, it is.
Heard that
it is. It's the aging process.
It stiffens more.
Right.
It's just not as flexible, so
Right.
it doesn't recover from those movements
Right.
as much as it, right?
So what happens is when those little crystals come loose, they start to float around in the semicircular canal in the fluid when your head is moved. And I brought a snow globe to kind of demonstrate it. I don't know if you could see the little snow inside, but picture this as our head. Now, when our head moves a certain way, okay, and then our head stops moving, the crystals keep moving and keep floating around in the fluid. And what happens is, even though our head is still, that fluid moving is telling the brain that our body is still moving. And it's really confusing it.
Yeah.
Oftentimes you'll see our eyes going back and forth a little bit because our visual input is telling us our head is still,
right. Yeah.
but our brain's telling us we're moving. So it's very confusing to the brain. And eventually, once our head settles down, or once the fluid settles down and the crystals settle down to the bottom, that dizziness goes away. But then if we turn our head in a certain direction, it doesn't have to be every direction, it'll start all over again. Oftentimes you'll hear patients complain that they're rolling over in bed in the morning to get up, and all of a sudden they just got suddenly terribly dizzy. A lot of times you could get it when you're tipping your head back. They used to call it top shelf vertigo, because when you're reaching up for something on the top shelf, you tip your head back.
Yep.
And it could happen tipping your head down. So any of those movements can do it.
So is just waiting it out one of the solutions, or there's...
Some people do that, and the little crystals can actually eventually dissolve. So people who go untreated, it will go away because they might dissolve, or it may not. It may recur and keep coming back.
Wow. So how is it treated then?
Usually the first thing you want to do is you want to contact your healthcare provider, your doctor, and they may treat it themselves, or they may send you to an ear, nose, and throat doctor. I got a lot of referrals when I worked at the hospital in outpatient from ear, nose, and throat doctors, and they were great because they could tell exactly what ear it's from, what canal it's in, and how to treat it.
Yeah. So that's really the first thing is for if people are feeling funny, to go talk to their doctor, get it diagnosed properly so they know, or is it?
Yeah, sometimes it could be so debilitating. You could be so dizzy and so nauseous, people can't move without getting sick. A lot of times people are seen in the emergency room and they give them a medicine called meclizine, which is like similar to Dramamine. It just kind of calms the whole nervous system down.
Oh, yeah.
So then you could at least move without feeling like you're going to get sick.
Yeah. So it is treatable.
It is.
Okay.
It's one of the, they say, the easiest things to treat.
Oh, that's
as far
nice.
as dizziness.
Because it sounds awful.
Yeah, it is. It's awful when it happens, but it's amazing how easy it is to treat.
Okay.
Yeah.
Do you want to talk about that? What
Sure,
the treatments are? Yeah.
What your healthcare provider will do will first of all take a really detailed history of, your dizziness symptoms, what kind of dizziness it is. If they do determine that it is the vertigo, they'll keep going in that direction. And then what they'll do is they will look at your eyes. I remember one presenter saying that your eyes are almost like a window to your vestibular system. They'll look at your eyes, they'll test all the movements, make sure it's working, they're working properly. And then they'll start doing some head positions. The first test is called a Hall-Pike test, where they tip your head in one position and then they lie you back very fast onto your back with your head tipped back. And what that does is it shakes up that crystal and it starts it moving. And what you're going to feel, what the patient feels, is they'll immediately feel the vertigo. And what the doctor or the therapist is looking at is they're looking at your eyes. And your eyes will start going back and forth really fast. That's called nystagmus. And you'll be feeling dizzy the same time your eyes are doing that.
Oh, yeah.
And then once the crystals settle down, the eyes will slow down and stop, and your dizziness will stop. So then they're pretty sure.
Then they know that's what it is.
Right.
Yes.
So what they'll do oftentimes is continue the treatment from that position. They'll turn your head in another position and then roll you to your side to another position. And what it's doing is it's actually getting that little rock or crystal to keep moving back to where it came from. And the theory is that once it's back to where it comes from, it kind of readheres.
Oh.
Sometimes all it takes is one time to do that.
Wow.
And they're feeling so much better.
So once it breaks loose, the whole concept of the crystal floating freely,
right,
it can actually go back to where it belongs.
Back to where it belongs.
Oh,
and
that's reassuring.
That's what the treatment's all about, getting it back to where it belongs.
Oh.
Sometimes it takes several trials of doing that over a week or so.
Okay.
And then they used to say after you had this done, sit still, don't do anything. But the new theory is get up and move around as much as possible, because moving around is good for your balance.
Oh, yeah. Yeah. Wow. So are there other common vestibular problems, or is that sort of the biggie?
Well,
with the crystals?
that's the biggie that I see. I've heard people having labyrinthitis or vestibular neuritis. Meniere's disease, I think a lot of people have heard of.
Oh, they recognize that name, yeah.
And then there's such things as vestibular migraines.
So migraines as we know it as a...
Well, they don't necessarily cause head pain. They actually cause dizziness instead.
Yeah. So you wouldn't have the headache that everybody's familiar with.
Right. So a lot of times the ear, nose, and throat doctor will again do a thorough history and try to find out and narrow it down that way.
So is that the only treatment then, when the crystal breaks loose and the fluid and we do the head tipping?
Yeah.
Are there other treatments that go with that?
For different types of vestibular problems like the labyrinthitis and neuritis, that's basically caused by a virus inflammation of that area.
Okay.
So a lot of times they'll use steroids, short term, to get the inflammation down. They could use antihistamines. Again, they could use things like Dramamine to calm the whole system down. There's diet. Diet's very important, like with Meniere's disease and migraines. Staying away from foods that are aged, like cheeses,
really?
Red wine, nuts, yogurt, and excessive alcohol. There's a whole list that's you could find on vestibular websites of foods to avoid. And a huge thing, which I should have mentioned first, is staying hydrated, drinking plenty of water or fluid. Dehydration can lead to, exacerbation of vestibular problems.
Right. Now, a sense of thirst is something that doesn't come automatically as people mature either, right?
No.
So that could play a big role for some in that population.
When I worked at the hospital, I remember reading people's diagnoses, and more often than not, it might not have been the primary diagnosis, but somewhere along in that list was dehydration. And I think we all forget to drink sometimes, especially like you said, when you don't get thirsty. And I've heard that when you have that sense of thirst, it's almost too late. You already are dehydrated.
Yes.
So have a water bottle near you all the time. And it doesn't have to be water. Water is probably the best.
Yeah, but that's one of those conscious activities that we take for granted, how valuable it really is to stay hydrated.
And people often ask, how much should I be drinking? And I've seen different formulas here and there, drink 6 glasses of water, 8 glasses of water. It's different. It depends on your body weight and your activity level. But they basically say, just check the color of your urine. If it's clear and light yellow, you're fine. If it's dark yellow, you're probably
You need more.
dehydrated. Yeah.
Oh, yeah. Now, do all fluids count? That, just throwing that out there because it's been a point of discussion because some are diuretics and
Right.
so you hear
Right.
maybe coffee doesn't count?
Well, you know, the last thing I heard, because I'm a big coffee lover, it said that caffeine, just in moderation, can be counted as fluids because it doesn't dehydrate you that much.
Okay.
So I mean, it obviously does have water in it, so it helps.
Yeah.
But you're best to limit caffeine to 2 to 3 cups.
Okay. And then go
more
back to
water.
water really is the best thing. Yeah. And what's the connection with the aged foods, the yogurts and the cheeses? Do you know?
It's just a trigger. It triggers those migraines.
It tends to be,
Yeah.
yeah. Fascinating.
Yeah.
Is there anything else people can do themselves to lessen the?
Oh yeah, definitely. As in with positional vertigo, oftentimes you could ask your therapist or doctor to give you home exercises to do, and you could actually do those maneuvers yourself.
Oh, the things that they did in
Right.
the office with lay back till
Yeah.
they had that.
Yeah. And also another very important thing to just keep your balance healthy is to be active. I went to a course once where the instructor said anything above rest is beneficial for your balance. So if you tend to sit on the couch a lot and watch TV, I recommend to people get up every commercial, and you don't have to go walk around. You could just stand up and weight shift a little bit or do a little leg exercise. It's something to get your balance stimulated.
Everything counts.
Everything counts.
But ideally, have a little exercise bike in front of the TV or something.
Anything would be great. Yeah, I actually often will tell people when they're sitting and watching TV to do exercises for their ankles, pumping up and down. I don't know if you could see my ankle, because a lot of our balance reactions take place in our feet and ankles. And as we get older and our ankles and feet stiffen up, we can't use those muscles effectively to help us balance.
Right.
I don't know if you've ever watched a gymnast on a balance beam. I remember watching the Olympics once, and the photographer focused in on the gymnast's feet, and every single muscle of their toes and feet were gripping and balancing.
Right.
And as we get older, our feet get a little bit more and more stiff.
Yes.
And one thing I have patients do, and they always look at me kind of funny, is I have them pick up cotton balls with their feet off the floor. A lot of people can't do that because their feet aren't that flexible. And even just trying to do it.
So grab it with your toes?
With your toes. I have them grab it with their toes, pick it up like that. And
I'm thinking about that.
Just little exercises to do that aren't,
you know, try it.
Yeah, or just, you know, if you drop a Kleenex on the floor, try to pick it up with your toes.
With the toes instead. Yeah. Wow. So now, once the dizziness has subsided, say, is it likely to reoccur? Are people susceptible to this?
Oh, definitely. With positional vertigo, it definitely could happen again. And if you already have those exercises you could do at home, you could certainly try that first to see if it helps.
Right.
Yeah. And Meniere's disease does tend to recur. You just never know when you might get a virus and it'll attack your vestibular system.
Right. So if you have a set of those exercises that you were given, keep them on hand, and you feel it coming on again, you could
try it.
Work on self-correcting because now it's not as scary. You're familiar with it. And does one continue going to rehab after the dizziness subsides?
Definitely. For any kind of a vestibular problem, whether it be the positional vertigo or anything else, getting rid of the dizziness is one goal, being able to function. But usually when people have bouts of labyrinthitis or Meniere's disease, they're really knocked off their feet.
Yeah.
Literally. For days. And I always used to see people come into the hospital, and they said before they came in they weren't using a cane or a walker, and they were pretty steady. But if they were in bed for any length of time, 2, 3, 4 days, it's amazing how unsteady people get because we're not exercising our balance. We're not challenging it.
Yeah.
So there's plenty of exercises you could do.
Okay, that would be
to challenge your balance.
Okay.
Yeah.
So the next best thing is, what else can I do to improve my balance?
There's
Those
a
exercises
lot of balance
available?
exercises that you could do. And I usually tell people to start by standing.
Okay.
And stand with your feet apart. Standing with your feet apart gives you better balance. So, and then if you feel steady and you're with your feet apart, try closing your eyes. But I wouldn't do any exercise without asking your doctor first. But try closing your eyes.
Okay.
And normally I have people do this with their backs in the corner of their kitchen counter.
Yep.
So if they do tend to lose their balance, they could catch themselves.
Yeah.
And then if you feel steady with your feet apart, eyes closed, I tell people to bring their feet in a little closer together and then close their eyes. And there's many different positions you could challenge people, and the most challenging is standing on one leg.
Okay.
But there's a lot of different things you could do in between to get them to practice. And it's amazing how fast people get better.
That would be my next. So how long does it last, and to reassure people that it will get better?
Oh, it definitely gets better.
Oh,
it definitely gets better. Even if you have permanent damage, there's, to one side, our other side could help, plus all the other systems can help too.
Okay.
So you could definitely get it better.
All right.
Yeah.
Believe it or not, we only have about a minute and a half left.
Wow.
It goes so fast.
Yeah.
Is there anything that we haven't touched on that you wished viewers knew about?
Yes, I have a couple little hints to tell people to be safe and to prevent falls. The first one was, if you're standing for any length of time and you're using your arms a lot, you're not able to hold on to things, stand with your feet apart. When you're in the shower, we tend to close our eyes. So what happens when you close your eyes? You're not going to be as steady, so keep your feet wide apart. Have grab bars. And if your balance isn't good at all, you should be sitting down.
Oh, they have those seats for the showers.
Right.
Yes.
Right. Also, standing with your hands in your pockets. Normally when we lose our balance, we use our arms. When you see a figure skater skating on the ice, their arms are out to the side, and that's for their balance. So I see a lot of people walking with their hands in their pockets. And
Don't do that.
It doesn't help.
Okay.
It doesn't help. Yeah.
Good.
Another thing, I just remember ways some of my patients have had falls. I had a patient who was walking across the room and deciding to get dressed at the same time, pulling a sweater over their head, and that was blocking his vision, and he fell.
Sure.
So whenever you're blocking your vision, be sturdy and
still.
steady. Yes, be still.
Focus one thing at a time.
Exactly.
Yes.
Exactly.
Great.
Yeah.
Well, thank you so much for being here.
You're
That's
welcome.
a ton of good information.
fast.
I know it goes easy, right? Donna, I appreciate it. Your time and your wisdom.
Oh, you're
That's
welcome.
good information.
It was
I
fun.
learned too. All right. And I'm Jeanne Sarnosky, wishing you good health and good health care.